歡迎大家嚟到。
Welcome to the media briefing today. The doctors we have today are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Lau Ka-hin, Chief Manager of the HA. Dr. Au will give us an update. Good afternoon, members of the public and media friends. I now report to you the number of COVID-19 cases reported yesterday on the 19th of May by the CHP. Yesterday, we have received 101 reports confirmed through PCR tests, including 15 reported by the HA, 18 by the Public Services Laboratory, and the remaining 68 were reported by private laboratories. And also yesterday there were 142 RAT positive results. Altogether, yesterday in Hong Kong, there were 243 positive cases. So far in the fifth wave, we have recorded 1,193,000 cases, including 748 and 1,394 PCR positive and 448,906 RAT positives. Yesterday there were 26 imported cases, and the remaining 217 were locally infected. Among the imported cases, 17 were caught at the temporary specimen collection center at the airport, and also 8 were caught during hotel quarantine, including 1 on the 3rd day, 3 on the 4th day, 3 on the 5th, and 1 on the 7th. The arrivals were from Canada. There were 6, and 4 from Taiwan, 4 from Singapore, 4 from the United States, 2 from India, 1 from France, 1 from the UAE, 1 from Spain, and 1 from Australia. And also yesterday there was 1 case which was found positive on the 12th day sample at the community center. That is a positive case involving a 46-year-old male received 2 jabs with no symptoms. On the 7th of May, he came to Hong Kong from India. During hotel quarantine, the tests were negative until the 13th of May. On the 17th, that is the 12th day, as the community testing sample, the sample was unconfirmed, and upon retesting, it was found to be positive with high CT value. That was 33, with very low viral load. We suspect the case to be a positive one. In terms of genome sequencing, the Public Services Laboratory has performed 70 tests. All samples are tested negative on L452R strain. For whole genome sequencing, we found an additional 11 BA.2.12.1 subvariants. The 11 cases involved 6 males and 5 females, aged between 19 and 65. 8 cases were from the US, 1 from Turkey, 1 from Holland, and 1 from Nepal. 6 cases were found to be positive at the airport. 3 were tested positive on the 5th day's PCR test at quarantine hotel. 2 cases involved a couple, that is at the 12th day sample as community testing center. So far, we have recorded 46 BA.2.12.1 positive cases. About the 2 cases, the couple tested positive on the 12th day. On the 16th, we have also mentioned them. On the 3rd of May, they came to Hong Kong from San Francisco via CX851. Now, they were quarantined in the Lan Kwai Fong Hotel, room number 3204. During hotel quarantine, all the samples returned negative. Upon completion of hotel quarantine, they went home at Shao Ki Wan. On the 12th day, that is the 14th of May, in accordance with the CTN notice, they went to submit a sample at the community testing center and were found to be positive. One of the couple is a 64-year-old female with 3 jabs. On the 12th, that is the 10th day after return, She had symptoms including coughing, headache, and fever with CT value of 15. So after testing positive, she was sent to the Penny's Bay Isolation Center. There were other people who traveled with her. That is a 65-year-old male with 3 jabs with no symptoms. On the 14th of May, also the 12th day after return, he was tested positive with a high CT value, 32, and low viral load. They had no positive records before. The virus strain is a BA.2.12.1. It may be a more infectious. So between the 10th of May and 15th of May, they went to some restaurants and had some activities. So the 11 places they have been to were issued with CDNs. People who have been to these restaurants during the mentioned period have to undergo a PCR test tomorrow and day after tomorrow. Upon investigation, we found that during hotel quarantine, there were 2 other cases in the same hotel. They knew each other. They were father and son. On the 7th of May, they came to Hong Kong from Nepal. One of the patients was found positive on the 4th day PCR test, that is at the 10th, RET. He was sent to an isolation center. The son who traveled with him, was tested positive on PCR test on the 5th day. So for the samples, that is, which are 3 PCR samples, were sent to the laboratory for a whole genome sequencing. The gene sequences are completely identical, so we suspect a transmission in the hotel. We have invited Professor Yuen Kwok Yung, a microbiologist from the Hong Kong U, to carry out an inspection in the hotel later today. For care homes, there were no reports from care homes yesterday. For schools, this morning, there were 18 reports, all RET positive, with 17 schools. The 18 cases include 13 students and 5 teaching staff. 4 samples were taken yesterday, and 14 were taken today. The 17 schools are 5 KG, a kindergarten and a childcare center with 4 students and 5 staff, 5 primary schools with 4 students and 2 teaching staff, with 1 primary school reporting 2 cases. That is 1 student and 1 teaching staff. They are not related. We believe that they were infected in the community individually. And 7 secondary schools with 5 students and 2 teaching staff. There are no clusters, and we have seen no outbreak in schools. For death cases, there were 4 additional deaths yesterday. So far, in the 5th wave, we have recorded 9,157 deaths. From previous clusters, there are some updates. Yesterday, the Shangwan, Tam Jai, Sam Go, Mi Sian, and Benchmark. There are no new cases from Tam Jai, altogether 5. We collected 16 environmental samples from Tam Jai yesterday, all negative. We have also collected the data of 25 patrons and 15 staff. CDN has been issued. We are waiting for the test results. In terms of a benchmark, among the 5 patrons at Tam Jai, 5 students at the school benchmark. So we have got a list of students and teaching staff at benchmark and 2 teaching staff and 10 students have found to be positive.
Yesterday, we reported that other than the 4 who have visited Tamjai, there's also 1 student who tested positive. And together with today's cases, from benchmark altogether, there are 17 cases, including 15 students and 2 staff members. So their onset started from May 13th to May 20th, and most of them were tested positive on between May 16th to May 19th. We collected around 20 environmental samples this morning, and we are still analyzing the data. So in Kwun Tong, there are 2 people who still haven't gone for the compulsory testing, and they have now done it. 1 is tested negative, 1 positive. So altogether in Imperial Restaurant, there are 30 cases. So that is all I have to report for today. Dr. Lau, thank you. Good afternoon. As of today, there are 553 patients in the public hospitals, North Lantau Hospital, Hong Kong Infection Control Center, and the Infectious Disease Center, 51 new infected cases. So out of those who need to be admitted to hospital, 91 of them are in isolated wards, and 23 in other isolated wards, and then 43 are in North Lantau Infectious Center, and there are 15 newly confirmed cases. Yesterday, 1 person is critical and 1 in serious condition, and there are 10 who are now in critical and serious condition. Out of 3 are in the ICU wards. There are also 4 other patients who in the past 24 years passed away, 1 male and 3 female with ages between 64 to 95. And out of the deaths, 3 are above 65 years old. None of them come from elderly homes. 3 patients do not have any vaccine records, and 1 has been triple jabbed. 91 patients have recovered, including 69 who have been discharged. In the 5th wave, there are 49,675 patients recovered, including 49,322 who have already been discharged. And since early 2020, we have logged a total of 62,055 recovered patients with 61,702 patients discharged. 2 patients have been found positive while being screened into hospital, and 9 patients have been listed as close contacts. In terms of staff, as of today, 23,009 patients have been confirmed positive, out of which 22,878 have already returned to their posts. That is all I have to report today. We now move on to the question and answer session. Please identify your media organization before you ask your question. Good afternoon from Cable TV. First of all, I'd like to ask about the Lan Kwai Fong Hotel at Khao Yu Fong. Are the rooms of those infected next to each other? So have they been tested positive on the same days? Well, on media, we see that Dr. Yun and other doctors have said that 70% people now already have antibodies to ensure there wouldn't be any serious infections. And then we could consider lifting more social distancing bans and perhaps to stop with the flight suspensions at the end of the year. Well, Dr. Yun said that the confirmed cases are not really accurate. Instead, to just report on the number of deaths and those in serious conditions. And I also want to ask that the scientific committee has suggested that those who are aged between 18 to 59 who have not yet been infected go for the 4th jab. So would that become a requirement for the vaccine pass? Thank you for your question. The first question is on the Lan Kwai Fong Hotel. There are now 2 groups of people who have stayed in the hotel. and they were tested positive. 2 arrived Hong Kong on May 7th from Nepal through India and then through Singapore to Hong Kong. And then 2 of them were tested positive on the 4th and 5th day of testing, which is on May 10th and May 11th. And they left the hotel respectively on May 10th and May 12th. One of them was found positive through PCR test on the 5th day, and the genome sequencing shows BA.1.12.1. And on the 2 who were tested positive on the 12th day, they have already left the quarantine hotel and found positive after they moved back into the community. They actually stayed on different floors. Initial report shows that they are on different floors, but they are facing the same direction. So we do not rule out the possibility that there is some sort of transmission in the hotel. Therefore, we will need to work on more in-depth investigation. The 2 tested positive on the 12th day. One has a lower CT value around CT 15. We believe that this lady for sure is not a repositive case. We are still investigating the source of infection, and it might have occurred in the quarantine hotel. There's a low possibility of being infected after she left the quarantine hotel because currently in the community we have not found the BA.2.1.21 subvariant, and the person accompanying her was also tested positive. So we are still working on the investigations, and we might have more details later on. On the second question, in relation to trying to resume normal activities during the summer, we see around 200 cases each day. It has steadied. There are many transmissions in the community. As to how the transmission would be in the summer, we don't know whether there will be any new variant. This is something unknown. At this stage, we need to stay vigilant with our social distancing measures, to don your mask properly. And for those who are still unvaccinated, please get jabbed as soon as possible, because you will need at least 3 jabs to prevent serious condition and death, because it has been proven scientifically that the vaccines are safe and effective in preventing deaths and serious conditions. Yesterday, the chief executive, together with the Joint Scientific Committee under the Center for Health Protection met, and they believe that a 4th jab may help lower infection. And 3 jabs of Sinovac or BioNTech could effectively prevent serious conditions for at least a few months. For the 4th jab, it is recommended that those who are age 60 or above, or those who are immunocompromised, to take a 4th shot. For younger people, the Joint Scientific Committee believe that the 4th jab can provide extra protection temporarily. Therefore, those between the age of 18 and 59, if they've never been infected yet, they are at higher risk, such as working in elderly homes or in hospitals, or there is a higher exposure in their workplace, could consider their own risk, choose to take a 4th jab. At this moment, this is not part of the vaccine pass requirement.
Concerning the announcements of the daily new infection number, like we said, we would look at the trend of the epidemic and consider a series of factors. We would look at the situation every day, besides looking at the daily new infection number We'll also pay close attention on the stress of the public healthcare system, including the new daily admission number, as well as the daily new admission to ICUs, serious and critical cases, as well as death numbers. Next question. Hi, I'm from Hong Kong 01. Now, the couple tested positive in the community on the 12th day. There are 11 places which are subject to CTNs. So what are the addresses? Now, the Shangwan Tamjai and the Benchmark School. This morning, 20 environmental samples were collected from Benchmark. So where were they? Did you get more samples from the classrooms? So far, the 15 students and the 2 teachers, have they all been to the classroom? So was it because you got the teacher and students list that you found 15 students and 2 teachers are infected? Is it because that the school did not require leap home safe? That's why no cases were found. So the positive cases occurred between the 13th and the 20th of May. However, the CTN doesn't cover the entire time period, so we should update the timing of the time period on the CTN. Final question, we are seeing more long COVID patients after recovery. Will the HA consider setting up a clinic treating long COVID patients? Thank you. Thank you for your questions. Now, the first question about the couple tested positive in the community on the 12th day, confirmed to be BA.2.1.2.1 strain. They left the hotel on the 10th of May in the morning. They returned home, and then on the 15th, they were notified of the positive results from the 14th. So one was sent to the Penny's Bay and one returned home for home isolation. Before that, they went to some restaurants. For the details, please refer to the CTN, which we will issue later tonight. These are mostly in Shao Ki Wan, including Shan Hong Fong Restaurant, Lei Yun Restaurant in Quarry Bay, and also the Café de Coral in Shao Ki Wan Lemon Street, and also Kings Road Café de Coral, and also Kim Street in Shao Ki Wan, Shinki Wonton Noodle, and also McDonald in City Plaza, as well as the Movie City Plaza in Tai Kwu Shing. And then Shao Ki Wan Dongfei Building, the McDonald, Oidong Estate McDonald, and also Kim Wah Street Sun Chiu Key restaurants, as well as Shao Ki Wan Oi Si Fen Chu. Concerning the actual dates and time slots of the CTN, please refer to the CTN tonight. About the outbreak and the cluster at Benchmark, on the 11th, between 11th and 15th of May, and there was a course at a Benchmark. We think that most students of the course were infected. There were some 30 students in the class, and 15 have already been tested positive. This is not a restaurant, so no leave home safe requirement was applicable. Some students did use the QR code, so we asked for the list of students and teachers from the school, and then we found some more cases. The exposure period is still between 11th and 15th of May during the course. Some patients began to feel unwell, but we think it was because of the course that they were infected. The premises comprise of teaching rooms and offices, and there are also lounges, and students can remove their mask and have some refreshments. And also during the course, some students pull down their mask to speak. these might be the cause for the infections. So we have collected environmental samples from the desks and chairs and the lounges, and we are waiting for the results. Dr. Lau, please reply to the question about long COVID. All along, the hospital authority has been following up the situation of recovered COVID patients. Doctors would monitor the clinical signs and results of tests. Appropriate follow-up treatments would be given to them. Our special disciplines as well as allied health colleagues would monitor the individual clinical situation of recovered patients and offer rehabilitation services to them. HK, universities and the private sector have been providing out of hospital Chinese medicine services at our 18 Chinese medicine teaching centers. So 6 months after recovery, recovered patients can receive as many as 10 free Chinese medicine consultative sessions for them. The HA will review our services and provide the appropriate services to the patients. Next reporter, please. One question from Independence Media. Professor Yun said this morning in the newspaper that the COVID virus is not going to go away. We should treat it as influenza. So do you agree with what he said? At present, coronavirus is still raging globally. We believe that in the end, the virus will become an endemic. So we have to buy time and enhance the herd immunity level in the society. We can do this through natural infection. After the serious fifth wave, according to studies, it is possible that more than half of the population has been infected and is now immune. The second way to build up an immunity barrier is through vaccination. So far, all scientific data shows that we have to get at least 3 jabs to keep up our immunization. So we urge citizens to get vaccinated and build up protection. After vaccination, the risk of complications and death would be significantly reduced. When most of the population is immune, even if there are transmissions of the virus in the community, there will be much fewer cases of complications, severe cases, or even deaths. Next question. Good afternoon, doctors. I'm from Mingpao Daily. Now about Khao Yu Fong Hotel. The father and son from Nepal, what are their ages? And what were their room numbers? And the couple from America, do they have any close contacts in Hong Kong? I mean, after they left the hotel and until they were tested positive, were there any close contacts and were there any confirmed cases among their close contacts? Is this the first time that we found the strain BA.2.1.2.1 in the community? According to your assessment, how likely is the couple going to cause an infection in the community? According to the WHO and the information that you have, the transmissibility, severeness after infection, what are the information for this virus?
I'd also like to follow up on benchmark. Does that mean to say that probably they only took off their mask in the rest area and they wouldn't be in any breach of any violations? We see from the map that it's only a few minutes away between Sky Cuisine and Benchmark. Do you think there are any association or links between these two clusters? For the environmental samples taken out of Benchmark, how many of them are there and when do you think you would have the results? Thank you for your questions. First, on the father and son, the father is 62 years old, the son is 27 years old. They quarantined in the same room from May 7th. So one of them was found positive on the 4th day and sent to isolation hotel, and the other on the 6th day. So they stayed in room 3304, which is a different floor from the other couple, but it's actually the same room with the same direction. There, of course, is transmission risk in the community. This is the first time that there is a person with BA.2.1.2.1 who is found positive after finishing quarantine. One of the cases showed symptoms on May 12th, and that person left quarantine on May 10th, and symptoms appeared on May 12th. And so it was tested positive on the 14th and sent to isolation on 15th. And they took off their masks and patronized restaurants. They stayed at home quite often and they wore their masks when they ventured out. But we cannot rule out the possibility of transmission within the community. To be safe for the places they visited, especially the restaurants, we have issued a CTN so that people who have been to those places would be tested as soon as possible so that we can cut off any transmission chain. We cannot rule out this possibility. So for BA.2.12.1, this is actually a subvariant of BA.2. And it's also similar to the variant BA.2.2. We'll need to wait for more scientific data to see whether a person can also be infected with BA.2.12.1 after being infected with BA.2.2. At this moment, however, there is no data showing that this subvariant shows serious conditions. And the transmission rate may be stronger than Delta and BA.1 based on the data from the WHO, but there is still no evidence showing that this subvariant will bring along more serious conditions. So we would need to look at more data before we can come up with any presumptions. At Benchmark, a confirmed patient may have taken off the mask during class. The students are not supposed to eat or drink in class and must don their mask properly. However, in the rest area, when they are drinking water, of course they would need to take off their masks. So they might have taken their mask off together in the rest area. The first case was found on May 13th. The person showed symptoms, and the student did a RAT before class and it was negative. But the second day, the RAT showed a very vague line and the person did not go to class that day. So that was the earliest case we identified. So that might have caused the transmission within the classroom. Next question, please. No other questions? I'm sorry, the speaker is off mic. They live on Tam Kong Mill Road. The couple who returned, I think it's an individual house, so we are not going to give the detailed address. Thank you.